I did, morally safe. Oh,
Sure.
Will the Senate please come to order? We'll observe a moment of silence in lieu of a devotional. Thank you. By way of announcement, I would just like to announce something that I wanted to speak about yesterday, and because the session was so long, I decided not to, but yesterday was Equal Pay Day, which falls on yesterday, March 26th this year, which symbolizes how far into the year women have to work to earn what men did the previous year. And despite slow progress, it appears that we've moved backwards in the last few years, and women are now making about 81 to 83 cents for every dollar paid to men, and the gap is wider for women of color. On a positive note, I would like to say that the resolution that we passed through the Senate dealing with gender equity in women's sports is on the agenda for the National Lieutenant Governors Association, where I am a member of the executive committee for the upcoming meeting, and my office has sent it out to them in hopes that this gets picked up by lieutenant governors around the country to further gender equity. And on a second quick note, if I look a little frazzled this morning, I am, because I spent the night sleeping out in Burlington with Spectrum Youth Services. And if any of you don't know what Spectrum Youth Services does, you need to. They're an absolutely incredible organization helping young people get their feet under and offering treatment of every kind and getting them set up for success with careers. They're an example of what we should be doing in every district of the state. So I may not have gotten much sleep, and I may have had a shower in the sink in the Marble Palace this morning. But I did that to show my support, and I would hope we could all continue to show our support. Senator from Chittenden.
Thank you, Mr. President. So senators will remember yesterday we had a complicated floor session, especially as regards S325 and many amendments that came forward. It got at moments a bit confusing. Unsurprisingly, when the Senate Secretary went through our actions from yesterday, he realized that in moving the Matos amendment, we had inadvertently deleted the Benson amendment. And so the morning has been spent working out a solution to this, and that solution, just so you know, has been reached with not only the Senate Secretary, but myself, the Minority Leader, the Chair of the Committee of Jurisdiction, and others. So what will happen is when I sit down, Senator Matos will rise and ask to reconsider his vote on his own amendment. If we vote for him to do that, that will take us back in procedure to that moment. If you've never been through this process, it's as though you go back in time to that moment, and we give permission for that to happen by our vote. And then Senator Matos will move an amendment that the Senate Secretary has drafted that will replace Senator Benson's material. And then we will vote on that. And then we will vote again on third reading of the bill and pass it. And then I will finish by messaging it to the House so that we won't lose a legislative day in the process. So just be assured that your leadership teams on both sides of the aisle have assented to this, as has the committee chair and the Senate Secretary. So with that, Mr. President, I'll leave it to the senator.
Are there any announcements? Senator from Chittenden North.
Thank you, Mr. President. Assuring the Senate I voted in the majority yesterday, I asked to reconsider my amendment to S325 as passed.
The senator from Chittenden North has moved that the Senate reconsider its actions taken on the vote, taken on his amendment to S325. Are you ready for the question? Senator from Washington.
I just have a point of inquiry on what the vote requirement is on a reconsideration.
Yes, a simple majority.
Thank you.
Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we will reconsider our vote on the amendment to S 325. Recognize the senator from Chittenden North.
Thank you, Mr. President. Now that we are back to my original amendment that was presented yesterday on the floor, I would like to withdraw that amendment and offer a new amendment that the Senate Secretary may pass out momentarily.
Without objection, we will pass out that amendment. Oh, it's withdrawn without objection, and we will pass out the new amendment.
Thank you, Mr. President. We're getting passed out right now, this new amendment that I am offering. First, I want to take a minute just to apologize to the Senate for my amendment yesterday after the good work that was done. And we will have this amendment here that will have both sections that were passed to include the Tier 1B areas in the interim exemptions to striking the 10-acre rule for parcels. So that will be shown here. It will be on the second page. Thank you. Second page at the top, you'll see the words constructed or maintained on a tract or tracts of land 10 acres or less. And that is struck from the interim exemption, so until 2030. And then down below, you will see that number 4 is added in, and as discussed yesterday, that is for the priority housing projects. 50 units or fewer, at least 20% of the units income-based, and that is my full amendment, and I appreciate the Senate support on this amendment. Thank you.
Senator Matos moves to amend the bill as he just offered and as distributed. The question is, Senator from Addison.
Thank you, Mr. President. I just want to clarify for people who were following closely yesterday, because I had this question, that the amendment now before us is a combination of the amendment from the senator from Chittenden North, Senator Matos, and the substitute amendment from the senator from Chittenden South, Senator Rom Hinsdale. And Rom Hinsdale's amendment was a substitute amendment to Senator Benson, the senator from Orange. So just in case, because I was confused to make sure that we were getting the combination correct, because I was following this closely, obviously. And for those of you who were, I wanted to make sure everyone else was clear. Thank you, Mr. President.
Senator from Addison, you get a gold star.
Thank you. I love gold stars.
Are you ready for the question? So all in favor, say aye. Aye. All opposed, nay. Ayes have it, and the motion carries. Please listen to the third reading of the bill.
S 325, an act relating to studying the creation of model bylaws.
The question is, shall the bill pass? Are you ready for the question? All in favor, say aye. Aye. All opposed, nay. The ayes have it, and we have passed S 325. Senator from Chittenden.
Thank you, Mr. President. If we might move to third readings.
Senator from Chittenden, we're not in the orders of the day yet.
My mistake.
But if you would like to message our actions,
Yes.
now would be an appropriate time.
Thank you, Mr. President. I would move that the Senate suspend its rules in order to message the actions just taken on S 325 to the other body forthwith.
The senator from Chittenden Central has moved that the Senate suspend its rules in order to message our actions on S 325 to the House forthwith. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. Ayes have it, and the motion carries. We have House bills for reference. H211. An act relating to data, broker, and personal information. Please, yes, please listen to the first reading of the bill.
S211, an act relating to data brokers and personal information.
Now you've heard the first reading of the bill. It's referred to the Committee on Economic Development. H577, an act relating to establishing the Vermont Prescription Drug Discount Card Program, introduced on January 6th, introduced by Representative Black and passing the House on March 25th of 2026. Listen to the first reading of the bill.
H577, an act relating to establishing the Vermont Prescription Drug Discount Card Program.
Now you've heard the first reading of the bill. It's referred to the Committee on Health and Welfare. We have S718, an act relating to building energy efficiency, introduced by Representative Campbell. It passed the House on March 25th of 2026. Listen to the first reading of the bill.
H718, an act relating to building energy efficiency.
Now you've heard the first reading of the bill. It's referred to the Committee on Natural Resources and Energy. H740, an act relating to the Greenhouse Inventory and Registry, introduced by Representative James. It passed the House on March 25th of 2026. Listen to the first reading of the bill.
H740, an act relating to the Greenhouse Gas Inventory and Registry.
Now you've heard the first reading of the bill. It's referred to the Committee on Natural Resources and Energy. H778, an act relating to dam safety, introduced by Representative Chapin. It passed the House on March 25th of 2026. Listen to the first reading of the bill.
H778, an act relating to dam safety.
Now you've heard the first reading of the bill. It's referred to the Committee on Natural Resources and Energy. H861, an act relating to establishing an Americans with Disabilities Act coordinator, introduced by Representative Barrows. It passed the House on March 25th of 2026. Listen to the first reading of the bill.
H861, an act relating to establishing an Americans with Disabilities Act coordinator.
Now you've heard the first reading of the bill. It's referred to the Committee on Government Operations. H915, an act relating to establishing an extended producer responsibility program for beverage containers, introduced by the Committee on Environment. It passed the House on March 25th of 2026. Listen to the first reading of the bill.
H915, an act relating to establishing an extended producer responsibility program for beverage containers.
Now you've heard the first reading of the bill, and it's referred to the Committee on Natural Resources and Energy. H931, an act relating to miscellaneous changes in education law, introduced by the Committee on Education. It passed the House on March 25th of 2026. Listen to the first reading.
H931, an act relating to miscellaneous changes to education law.
Now you've heard the first reading of the bill. It's referred to the Committee on Education. Orders of the day. Senator from Chittenden.
I was hoping that we might go to third reading, then come back to S142 and go down the calendar.
We have third reading of S64, an act relating to amendments to the scope of practice of optometrist. Are there any amendments prior to third reading? Seeing none, seeing Senator from Orleans.
I don't have any questions, Mr. President, on, or amendment. I just want to clarify and answer a question for the Senator from
You
Washington.
have the floor, Senator.
Thank you.
Oh, he's supposed to wait till after the third reading, sorry. Listen to the third reading.
S64, an act relating to amendments to the scope of practice for optometrists.
Now you have the floor, Senator from Orleans.
Mr. President, yesterday, I believe the senator from Washington asked about where we're getting some of the data points on safety on some of these advanced scope practices. And so with that, spoke with OPR, and they work both the optometrists and ophthalmologists in conducting its work, and we're not provided with any data demonstrating that optometrists performing advanced procedures had higher regulatory complaint or discipline rates or higher malpractice rates in the states where those procedures are being currently performed. Also, OPR conducted research to find reports of regulatory complaint data or disciplinary data regarding optometrists performing advanced procedures and did not find any. So I just wanted to make sure I answered your question. Thank you, Mr. President.
Are you ready for the question? The question is, shall the bill pass? All in favor, say aye. Aye. All opposed, nay.
Nay.
The ayes appear to have it. The ayes do have it, and we have passed S64. We're now on S278. Are there any amendments prior to third reading? Senator from Chittenden.
Yes, Mr. President, I do have an amendment, but it's not the one in the calendar. I'd like to withdraw the one from the calendar, and instead you should be receiving one that is very similar to the one in the calendar, but with one small change. So if you look at the amendment in the calendar, it's effectively that, but one wording change at the end. But again, not offering the one in the calendar, take a look at the one in front of you being passed out now. Mr. President, a year ago, this legislature asked the Cannabis Control Board to review the fees we charge outdoor and indoor cultivators of marijuana in light of the maturing regulated marketplace here in Vermont. The result of that report highlighted a few key points inspiring this amendment. While our current fee structure acknowledges a difference between indoor and outdoor cultivation, it does not reflect the reality of productive capacity. An indoor license allows for perpetual harvests yielding 4 to 6 times the product of a single Vermont summer. And that's all outdoor cultivators get. One season, one shot each year for their crop yield. To truly align the cost of a license with the opportunity it provides, the outdoor fee would best be adjusted to a 1-to-4 ratio relative to indoor costs. This amendment does just that, informed by a thorough report from the Cannabis Control Board. Cutting the outdoor fees in half would ensure that our outdoor farmers are not paying a seasonal penalty for working with the sun instead of high voltage lights. Vermont has a proud history of working in harmony with the land. By reducing outdoor fees by 50%, the state would be reiterating that we value working lands and sun-grown agriculture. Farmers in Vermont have a really rough go at it. From tilling Virgins clay to late frost, from finding flat stretches of land to devastating floods, it is hard to grow outdoors in Vermont. Aligning the license cost with the actual yield potential isn't just a math correction, it's a necessary step to prevent our small outdoor cultivators from giving up on their fields. Now, we don't charge any fees like this to grow other crops, and I get it, it's pot, so we want to regulate it. But in these discussions, multiple senators suggested we should be charging these fees on beets and Brussels sprouts since nobody likes those crops. Alas, that's likely a discussion for another day, and I encourage our Senate Agricultural Committee to consider that, especially Brussels sprouts. Mr. President, this amendment in various forms was presented to the committees of jurisdiction, but yesterday, based on feedback from the Appropriations and Finance chairs, the last section was added, which conditionally enacts these lower fees if money is appropriated this budgetary cycle to, and this is where the change is and what's passed out, if it's actually appropriated to the Cannabis Regulation Fund. Since that was added after our long floor session yesterday, I did not have time to present this newest version to all the committees of jurisdiction, but I hope this aligns enough with what they had seen either to be supportive of this or to at least not be blindsided by it. I did actually ask the Policy Committee of Jurisdiction, Senate Economic Development, Housing and General Affairs, for their opinion on this morning, and that was a 5-0 support, straw poll vote in support of it. Thank you, Mr. President. I'm happy to answer any questions.
The junior senator from Washington, I think, was up first, so we will start there.
I thank the presenter of the amendment, and it was not blindsided by this amendment at all. But since our committee hasn't had a chance to talk about it, I would like to call for 5-minute recess.
Think if we have a brief recess, both chairs can meet with their committees in whatever corner they choose. We'll take a brief recess.
I gotta be back.
Will the Senate please come to order? Senator from Washington.
Thank you, Mr. President. Assuming that the senator from Chittenden would favor his own amendment, the straw poll in finance was 7-0 in favor.
Senator from Washington.
Thank you, Mr. President. The straw poll from appropriations with this change that we appreciate the presented amendment making was 7-0-0.
Are you ready for the question? Senator from Chittenden.
Thank you, Mr. President. As someone of Eastern European descent, a culture where beets and cabbages are a staple component of my diet, I take objection to the assertion that nobody likes beets or Brussels sprouts.
Senator from Chittenden.
My sincerest apologies, Mr. President.
Senator from Essex.
Mr. President, I hate Brussels sprouts.
All right. Senator from Windsor.
Thank you, Mr. President. And I appreciate the amendment, although I have some concerns. And I just want to understand, with asking a question of the presenter, the amendment.
The presenter is interrogated.
So in your amendment, you have section 10A, the way bottom of your printout. and it says that provided that on or before the General Assembly has appropriated or transferred the amount. And maybe this is a question for appropriations, but since they voted in favor of it, I'm wondering if we could get a description of this section and the reality of its coming to fruition.
Thank you, Mr. President. I'll give a swing at that question, and then I'd certainly welcome anybody from Appropriations to correct anything I say. This was important contingency language in order for this to be more comfortable to members of the Appropriations Committee that I spoke to. This effectively is, from what I'm told, is common language used in the budgetary process to put things on the list, so to speak. So in the broader negotiations, as we look at pros and cons of all the things that need money throughout the entire big bill discussion, this is language that makes it easy for this to just be one other consideration that's not lost in the shuffle, so to speak, and that as the final big bill budget comes together, this will certainly be part of the considerations, but does not tie the hands, and it also makes that process easier. That's my understanding.
Okay. Yeah, I thank the presenter of the amendment. Ultimately, I will be voting no on this amendment. I do appreciate the logic of the outdoor grow season being shorter, but I don't think that this is a fair reduction in comparison to indoor growers with their fees. And while I understand it was a recommendation of the Cannabis Control Board, I also think that the tightness of our budgets at this point to alleviate the fees for this specific industry at this time would not be in our financial best interest. So I will be voting no on this amendment, although I appreciate the introduction of it. Thank you.
Are you ready for the question? The question is, shall the bill be amended as offered by the senator from Chittenden? If so, all in favor say aye. Aye. All opposed, nay.
No.
The ayes appear to have it. The ayes do have it, and we have amended S-278. Are there any further amendments? Senator from Chittenden.
Thank you, Mr. President. I do have a small amendment. I would argue it is an equity amendment to offer to this bill. What my amendment that is being passed out would do would give renters a place where they can legally use cannabis. Presently, there is no public use of cannabis allowed, and landlords can prohibit renters from using cannabis in their home. So what this amendment proposes to do is disallow the prohibition of cannabis consumption within the four walls of a rental property, with the exception of lighted cannabis. So it can still be prohibited for one to smoke cannabis in their home. But presently, we have a legal market to which renters can be completely shut out from legal use. And this amendment proposes to alleviate that, and I hope the body will support it. Thank you.
Senator from Chittenden.
Thank you, Mr. President. Both our transfer of cannabis to an illicit substance to a regulated market, as well as landlord-tenant law, often fall through the cracks between the two committees of jurisdiction, Judiciary and Economic Development. So we greatly appreciate this warm handoff of a member of the Judiciary Committee presenting us with an amendment that we probably wouldn't have been able to bring forward ourselves under our jurisdiction, and the straw poll was 5-0 on this amendment.
Are you ready for the question? Senator from Caledonia.
May I inquire of the presenter of the amendment?
The presenter is interrogated.
My question is largely around the federal structure here, and that in many of our housing units in the state, they are federally subsidized in one way or another. What would, by making it legal for somebody to use what is a tier one product in one of those spaces, what could be the potential unintended consequences of allowing that?
Thank you, Mr. President. I would like to ask for a short recess to confer with counsel.
We'll take a short recess. Will the Senate please come to order? Senator Beck and Senator Vyhovsky have the floor.
Thank you, Mr. President, and I thank the senator. This is an important question, and the attorney that will help us answer it and potentially solve it if it is a problem needs some time. So we will get back to you with an answer.
Okay. Thank you, Mr. President.
Senator from Chittenden.
Thank you, Mr. President. As my colleague just said, we need a few moments at least for the drafting of an amendment. So I would ask that we pass over S-278 for the moment and go back to the top of today's calendar, which is S-142, an act relating to a pathway to licensure.
We have on the calendar for action S-142, introduced on April 3rd of 2025. It was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the bill be amended as set forth in the calendar of today on page 1120, and that when so amended, the bill ought to pass. Affecting the revenue of the state, the bill was then referred to the Committee on Finance, which reports it has considered the bill and that the bill ought to pass when amended as recommended by the Committee on Health and Welfare. Affecting the appropriations of the state, the bill was then referred to the Committee on Appropriations, which reports it has considered the bill and recommends that the bill ought to pass when amended as recommended by the Committee on Health and Welfare. Listen to the second reading of the bill.
S-142, an act relating to a pathway for licensure for internationally trained physicians and medical graduates.
I recognize the senator from Orange, Senator Benson, for the Committee on Health and Welfare.
Thank you, Mr. President. For those who wish to follow along, the bill is presented on page 1222 of today's journal. This bill does exactly what its title says. It provides a pathway for individuals who are from other countries who have been trained as physicians to have a pathway to actually practice here in the state of Vermont. So if we go down through it, section 1, and before I do that, I would just say there are other states that do have a program to allow individuals who come from other countries to get licensed and practice as physicians in their states. And we, through testimony, heard that there are several individuals here in the state of Vermont who actually were licensed physicians in their country of origin, but cannot practice to their potential here in the state. So they're doing functions far below their capacity in our healthcare system. So this would give those individuals, and also hopefully to attract new physicians to come to our state and follow this pathway and actually help to alleviate our shortage of doctors in our communities. So if we look at section 1, it talks about qualifications for medical licensure. This section amends 20 VSA 1331, which established qualifications for medical licensure to allow the Board of Medical Practice to issue licenses to practice medicine to an internationally trained physician or medical graduate who completes the pathway to licensure established in this bill. Section 2, this section adds a new subchapter to the chapter on the Board of Medical Practice and Licensure for physicians. The new subchapter creates a pathway to medical licensure for in Vermont for an individual who has received a medical degree and has been licensed to practice medicine in a country other than the United States. The pathway to licensure would require the individual to meet certain education, and examination requirements, complete a 2-year supervised employment with a participating healthcare facility approved by the Board of Medical Practice, not to have previously had a medical license revoked or restricted. The board will issue a provisional license to the individual for a 2-year period of supervised practice at a participating healthcare facility. After the 2 years of provisional license, the individual can apply for a 2-year limited license, which requires successful completion of an assessment and evaluation program at the participating healthcare facility and offer a full-time employment from the same or a different Vermont healthcare facility. Achieve a passing score on step 3 of the U.S. medical licensing exam. After the 2 years of practice with a limited license, the individual can apply for a full unrestricted license to practice medicine in Vermont. The Board of Medical Practice will collect and report annually on implementation and success of the Pathway to License program, including information on the number of applicants and their countries of origin and training, number of provisional and limited license granted and refused, and the reason for refusal. Rulemaking under Section 3. This section would require the Board of Medical Practice to adopt rules to implement the Pathway to Licensure program, including determining which countries' licensure to practice medicine would be acceptable to the board and the criteria for participating healthcare facilities to use in assessing and evaluating an internationally trained physician's readiness to practice medicine in Vermont. Now, when we heard from the Board of Medical Practice, they were in favor of moving forward with this bill, but they also had some questions on just how they would implement this. And after discussion, we added this Section 4, which is the alternate pathway to licensure for individual trained physicians and medical graduates. And what this section does is it directs the Department of Health, in collaboration with the Board of Medical Practices, to report by January 15th of 2027 on the pathway to licensure for internationally trained physicians or medical graduates as an alternative to the pathway established by this bill. The report would include a summary of other states' procedures for licensing internationally trained physicians and data on their outcomes, a description of the external resources needed to evaluate the education, experience, and examinations of the internationally trained physicians and the availability of those resources, a provisional proposal for licensing internationally trained physicians and medical graduates in Vermont, including the qualifications and supervision requirements, resources, and statutory authority needed, and an implementation plan and timeline. So this basically gives the board the opportunity to come back to us with amendments to that pathway if they believe that it's either insufficient or should be changed in any way to make sure that the individuals who license here in Vermont can perform the job that we intend them to do. Section 5 lays out the effective date. Section 1 and 2 establishing the pathway to licensure would take effect in July 1 of 2028. Section 3 rulemaking would take effect on July 1 of 2027. And Section 4, as I indicated, would require them to come back and report by January 15th of 2027. Thank you, Mr. President.
I recognize the senator from Chittenden, Senator Gulick, for the report of the Committee on Finance.
Thank you, Mr. President. The Committee on Finance looked at this bill and did not see any fees. It certainly contemplates the possibility of future fees, and we found that very agreeable, and we recommend that the body, that the Senate support this bill, and that the bill ought to pass when amended by our committee, and the vote was 601. Thank you, Mr. President.
I'd now like to recognize the senator from Chittenden, Senator Lyons, for the report of the Committee on Appropriations.
Thank you, Mr. President. There are actually no appropriations included in the bill for 27, for the budgetary year 27. There will be potentially for the next fiscal year 28 as the program is implemented. But your Committee on Appropriations voted favorably, 7-0-0, to move this bill forward. Thank you.
So the question is, shall the Senate amend the bill as recommended by the Committee on Health and Welfare? Are you ready for the question? Senator from Chittenden.
Thank you, Mr. President. I just wanted to share my thanks with the senator from Windham who brought this bill forward. Many of our constituents, we have many constituents who are highly trained, highly skilled physicians who have not been able to practice in the state of Vermont. And one other data point that we received in our committee is that internationally trained physicians will often work in rural areas. That has been shown to be the case in other states. So we're really excited about this and look forward to a future where our highly trained physicians can practice in our state. Thank you, Mr. President.
Senator from Essex.
Thank you, Mr. President. I was originally going to ask to interrogate the report of the bill, but the report was so thorough that it answered all my questions. And the reason I was going to interrogate was a story that I have to tell of some folks that I met that immigrated from China. The husband was a surgeon and the wife was a nurse, an RN, and she immediately found work in Boston, and not only found work, but headed up an apartment. And the husband, as a very busy surgeon in China, couldn't get a medical license at all. So I was just wanting to make sure that the protections were in place, and so that same occurrence would be able to be discovered in Vermont. And again, I'm very satisfied with what I heard during the report. So thank you, Mr. President.
Are you ready for the question? The question is, shall the Senate amend the bill as recommended by the Committee on Health and Welfare? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we have amended the bill as recommended by the Committee on Health and Welfare. Question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and you've ordered third reading of S-142. We have on the calendar for action S-190, an act relating to the Green Mountain Care Board reference-based pricing and hospital outsourcing of clinical care. It passed the Senate on January 6th of 2026. It was introduced on January 6th of 2026. It was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the bill be amended as set forth in today's calendar starting on page 1122, and that when so amended, the bill ought to pass. The bill was then referred to the Committee on Appropriations, which reports that it has considered the bill and recommends that the amendment proposed by the Committee on Health and Welfare be amended as set forth in today's calendar, and that when so amended, the bill ought to pass. Listen to the second reading of the bill.
S-190, an act relating to the Green Mountain Care Board, reference-based pricing, and hospital outsourcing of clinical care.
Recognize the senator from Chittenden, Senator Lyons, for the report of the Committee on Health and Welfare.
Thank you, Mr. President. I believe I have a handout for the bill that I would like to begin with before diving into the sections of the bill. You could have that. So just a couple comments, Mr. President. As we go through our bills in here from Senate Health and Welfare that relate to transformation, health reform, healthcare savings, cost benefits, and so on, it's complicated, and there's no question that it's complicated. And also, there was a question on the in the Senate on S-190 regarding what are the benefits what are the outcomes that we're getting from the work that we're doing. So I thought what I would begin with today was kind of a quick, very short summary of some of the results that we're seeing from the work that we've been doing in this chamber and in this building. So obviously we understand some of the problems. We know that the hospital high costs are exceptional. They're higher than the whole country. We know that administrative charges are high. We know that our hospitals charge 3 to 5 times the Medicare amount. But we also know that our hospitals many of our hospitals have reached a level of financial unsustainability. And so that's one set of problems. And we also know that there are high costs as a result for patients, that our premiums in this state are 3 to 5 times higher than Maine. We're the highest in the US. Our prescription drug costs have been extremely high as well. That's kind of uniform across the country. So we've been looking at, and these are just some of the issues that we face in our committee as we take up our discussion on various bills. So if you look at the problems that are listed there, and then the second column are some of the actions. This is an incomplete list by any means, but only goes back to 2022. So we've been working on this for so long that people are leaving the chamber and no longer here who remember all this. But Act 167 that we are familiar with is the beginning of a large transformation process that put in place what's known as global budgeting that allows for the Green Mountain Care Board to provide for global budgeting for hospitals. And that is to set a comprehensive amount that hospitals can achieve or have within their budget each year. We also passed last year Act 68, which reaffirms our strategic plan, healthcare plan, and improved transformation, hospital transformation to lower costs. And then we also know that in addition to our actions through our relationship and work with the board has passed budget orders for this year, fiscal year 26, that have lowered costs. The results of just those few things, and I would like to say, when you see that word transformation, that's the responsibility that our hospitals have for transforming themselves from a very high-cost organization to an organization that is more affordable for folks in our state. The amount of money that's been saved through the work that hospitals have done independently and then collaboratively. Some of our hospitals are working together, particularly some of our smaller hospitals, our critical access hospitals, working together to save money. We're seeing the benefit. We're seeing that they've saved $100 million. We're seeing the total reduction of $230 million within the budget process. We're seeing that some of our hospitals who have been economically fragile now have more cash on hand, days cash on hand, which is a measurement of their financial sustainability. I understand the questions I get about what are we doing, what's the outcome. I'm hoping this will help you answer some of those questions. Then we look at what's going on with patients. And the question is, all of this reduction in spending, how is it affecting us and our premiums? And how does it help the small businesses or the individuals in the insurance market? Well, and that's part of what's in S190. We're trying to move some of those savings into the pockets of Vermonters so that the cost of care and the cost of premiums will be less intrusive into their lives. So if we look at the patient high costs, and then we look again, we're looking at just a couple of bills here, Act 167, Act 68. We've had payment changes for 27. We asked the board to please put in place some reference-based pricing criteria for fiscal year 27. That's the one coming up. S190 reaffirms that and actually puts some conditions in place that will help us move forward to lower the charges that we all face when we go into the hospital environment. So that's the reference-based pricing piece that we will be talking about in S190. But beyond that, we've also had, we have passed at least one law. We've passed a lot of laws on prescription drugs. But the one that we passed last year that put the 120% cap on more expensive fusion cancer drugs and so on has demonstrated savings, and that's the savings that you see there, that $12 million that you see there, that is only for educators and education staff. So that's just one little chunk of premium savings. So that's $12 million that we saved in our school system for those healthcare premiums. Then we also know that the insurance companies have recently removed GLP-1 drugs for a number of folks, not everyone, there are some who are still covered, but taken that out of insurance. That is the $16 million that's been saved, and again, that's only for education. So I'm trying to demonstrate to you what we've all been concerned about is the effect of healthcare costs on our education property taxes. So you look at the bottom and then you'll see the education premiums with a reduction of between 3 to 10%. In my own district, that savings is about 3%. So it will change over time. But that's good news for us because our constituents want to know that what we're doing in here translates into support for their work. So, Mr. President, that I hope that is somewhat helpful to you. I will say that as we look at the actions that have taken place under Act 68, for example, we know that insurers, providers, and others have been very much involved in this process. In addition to hospitals and regulators, it's been everyone together working on this, and I hope that we will continue with that process. So I won't dwell on this, but I will say if you need more specific data, numbers on how much our premiums are and how we relate to the rest of the country, I'm glad to do that. I just will say that we do have the highest premiums in the country. The average premium cost for patients in this state is about $10,000. And I know people are paying a whole lot more than that. I've heard from a lot of people. I talked with a young man, he's probably not young, middle-aged, because he has two young daughters who are now in college and high school. And he was saying, I can't send them to college because I'm paying for health care. And I can't afford their health care at the same time that we're trying to save for college. So people are in those dire situations. They really are.
Thank you very much.
Anyway, so, Mr. President, I'm going to move into the bill very briefly, and then we'll flip the page over. You can flip your page over, and we'll get to reference-based pricing in just a minute. I would like to say that one of the problems that we have and that the Green Mountain Care Board has in solving this whole problem is its complexity and how to work with very large organizations, our hospitals, to have change take place quickly and effectively. It's not an easy process. I know you all hear from your hospitals, and the hospitals say, we can't do this, we can't do that. At the same time, the board is saying, you have to do this, you have to do that. It's that constant tension and pressure. We feel that in our committee every single day. And we've gotten to a place, I think, with this bill that I think is going to help move us all forward and ultimately is going to save Vermonters costs, money. So really briefly, as you recall, because we've talked about reference-based pricing in here before, this is a standard or a benchmark for healthcare services. It's pretty much based on Medicare-based payment. And we have a goal, if we have a goal in this state of between 200 and 250% of Medicare-based payment, why do we have that? That's kind of the national average. So we're trying to get even with what's going on in other states where where premiums are lower and hospital costs are lower. So the push down from where we are, some of them are way up high, the push down will take time. Hospitals have to adjust their charges and what they receive and their budget process. So we feel that, I won't go through all the reasons why this is an important number, but it's a reasonable ceiling based on experience. It also allows for some decision-making that is not year to year, but then there's decision-making consistently. You always know that's your goal, right? So you don't have to just fuss around about it. Not easy. There is built into all of this, there's a whole lot built into what the reference price is. There's the condition of the patients that go into the hospital. There's inflationary issues like Medicare Economic Index that we had talked about in another bill earlier this week. Was it this week? I can't remember. This week's a long week. So S-190 adds the 250% of Medicare for hospital payments, but only for qualified health plans. So the qualified health plans are for those folks, individuals, small businesses. So we're setting that target, it's actually putting it in place. We're implementing 250% of Medicare for qualified health plans for payments to hospitals. That's a big deal. It's significant. There will be savings. That's huge. It's in the 2027 budget. Hospital budgets are approved or looked at in October of this year. Right now, hospitals are looking at what the Green Mountain Care Board guidance is. Then they'll put their budgets together, pass their budgets, and hopefully the benefit will be realized in premium reduction. It will be. Okay. So then within the bill itself, there's another little piece. Okay, so what we find out is that some hospital services, as you can see on that second page, some hospital services are high. So 300%, 500%, some as high as 1,000% of Medicare. It's very high. And so how do you take that charge and push it down? How do you push it down to 250? That takes time. So there's a section of the bill, first section of the bill, that allows for some time for that pushing down. That isn't all going to happen in 27. That takes a bit. Now, one of the things that we do have in the bill is if any hospital has a charge over 500%, I call it a little cap thing. Any hospital that has a charge of over 500%, then you're going to have to bring those down first. Those are the first things you look at. If you have something that is at 255, that's probably less important, okay? So start bringing those costs down. Start looking at those costs and bring them down. Now, when you talk about reference-based pricing, everyone thinks it's the panacea. Well, once you've got 250% of 250% of Medicare, you're golden, right? All done, right? No, that's not the case. So look at the 2018, the numbers down there. Hospitals set their own rates. So hospitals are setting the rates, their little reference-based prices. In 2018, for example, one example is 276% of Medicare. In 2022, same hospital, same charge, 316% of Medicare. Regardless of what other conditions are. 23, it went up even higher. In 26, that number is 500% of Medicare. So even when you start talking about having a benchmark, if you don't have some downward pressure on it, or you don't have some regulation that keeps it in place, it's going to go up. So charges will go up. So the point here that I'm trying to make is we need to also have this structure, this financial payment structure, be done within the context of budgeting oversight. So that's where the sort of what we call the global budget, or that's what we call the budget order from the Green Mountain Care Board. That's where that comes into play. So, Mr. President, you have an inkling of an idea here now about what we've done, what our savings are, and what our goal is in terms of encouraging additional savings within hospitals. That's going to take some time first for hospitals to do it. And then secondly, but really to move forward with alacrity in 27 to save money for our qualified health plans, about 88,000 people in Vermont, small business, individuals, to hold the line on those costs. That's what's in S190. It is an important piece of our affordability within the healthcare system. So you have that pretty little graph, chart. Now, here's what I'd like you to do. You're going to have to ignore something and look at something. So where it says base, that's the third set of bars, okay? That would be the Medicare base payment, okay? If you look over where it says current, that first little set of bar graphs, current, that's what the hospital current base payments are, okay? Got it? Now, if we add 250% to the base, that's what the reimbursement rate will be for our critical access for our hospitals, okay? If we could take something like a 225%, which was in the amendment that I'm going to withdraw. This is just for example. And you put that 225% onto the current hospital charges, look at what happens to the cost compared to 250% on the Medicare base. I hope I'm not confusing you. The cost is higher. So our goal here within our bill is to make sure uniformity across hospitals for a payment base, and that we have time for hospitals to implement that payment base. And at the same time, we have an opportunity to look at premium savings within our qualified health plans. So, Mr. President, if we can go to the bill briefly. So overall, I'd like to say that your Senate Health and Welfare Committee is very positive about the work that we're doing in this, with this bill. I'm bringing it to you with the next step in adding in results. We're adding in some really cost containment putting money back into folks' pockets for the premiums and seeing some results that will have an effect. So just going to the bill, and I think it's on 1224. Hope so. And section 1 of the bill, this is a little reference-based pricing section requiring hospitals and insurers to begin expressing rates as a percentage of Medicare for items and services in their provider contracts. So they have contracts with insurance companies and with, they have contracts with individual providers, insurers with individual providers. So as of October 1st, 26, requires hospitals to provide their publicly reported prices both as a percentage of Medicare rates and in dollars and cents. It's transparency and clarity. And it has to be disaggregated by insurance plan and payer. It's complicated to do that, to sort that out. It will take time. The Green Mountain Care Board has volunteered that they will be working on this when we look at the next section on 250%. Each hospital, it allows each hospital to express its rates as a percentage of Medicare based on the actual reimbursement rates that hospitals receive from Medicare until the Green Mountain Care Board adopts a reference-based pricing rule that establishes the methodology for determining Medicare rates. There's a period of time within which the hospitals will be doing their work. There'll be variability in the reference-based price for individual hospitals, and then the Green Mountain Care Board will find resolution and offer a specific number. And that will be variable by hospital and variable by type of patient, the risk pool within the hospital. So there's a lot that goes on behind the scenes with this. It's not just something, boom, you do it. Okay, there's a lot of work on here. It also requires the hospitals to identify themselves. So it's a national provider identifier. It's that follows the hospital, whether it's in hospital work or whether it's outside of the main campus. And that will be by October 27. So they'll begin using that identifier by October 27. Section 2. This is the qualified health plan benefit plans. This section limits the amounts that health insurers can pay hospitals for services provided to enrollees in qualified health plans, QHPs, or they're also known as exchange plans. So it'll be up to 250% of Medicare rates. This projection for this is about $50 million in savings. Good thing to hear. This section also requires the Green Mountain Care Board to ensure, this is the part I like, this is one that has continuously bothered me, that we don't have, but the section requires the Green Mountain Care Board to ensure during their rate review that the hospital reimbursement caps are appropriately reflected in premiums for qualified health plans. So when we have savings, they go back to the people who need those savings, us. Section 3, this section adds a definition of Medicare adjusted base rate for the purpose of hospital budgets and budget review. The base rate, the standard that we're talking about. And then the section also directs hospitals to implement any commercial reimbursement rate reductions ordered by the board, first through the caps on reimbursement for qualified health plans, and then by reducing the hospital's commercial reimbursement rates that are more than 500% of Medicare. That's the section there where we're looking at the very high charges and trying to move them down to 500 or below. And then it allows for the hospital to propose to the Green Mountain Care Board, allows hospitals to propose an adjustment to commercial rates for certain service lines if the reimbursement caps are negatively affected and affecting access, quality, or sustainability. Well, all this says is that if the provisions that we're putting in place for the 250% is going to put the hospital under financially, that the hospital has an opportunity to demonstrate that and make changes in the budget. process. Then there is a section 4. We were approached by Vermont Education Health Initiative, VHI, our school folks, and state employees who are very interested in establishing a public reference-based pricing project and looking at how plans and opportunities for reference-based pricing would help in our state. So by January 27, the board will report to the General Assembly with findings and recommendations on the scope, timing, and financial impacts of implementing reference-based pricing for the state employees' health benefit plan and for VHI plans. And this is a voluntary action on the part of these two organizations. There are projected savings for this one as well. There's a section 5 on hospital outsourcing. There were concerns, initial concerns expressed about how hospitals are outsourcing some of their services. Now, there's a whole emergency room that's outsourced in one of our hospitals. The concern was that the earnings from those outsourced services would not support what we have as a provider tax. As we investigated it further, we found out that outsourcing is a tradition, and there was some confusion about how it would affect hospitals and patients. So we've asked for some information about the outsourcing and how it may or may not affect provider taxes. And we'll get that information back in January of 27. There's an old section of law, healthcare provider bargaining groups, and this really just is technical correction and takes out the old healthcare authority bargaining unit budget and bargaining unit that says that these one bargaining unit left in the state will not bargain for or consider reference-based pricing. Section 7, this is a section on appeals and the Green Mountain Care Board. Green Mountain Care Board, analogy to the Public Utility Commission, the PUC. PUC has appeals going directly to the Supreme Court. This puts that in line. Now the board, Green Mountain Care Board, will also have that appeals process from the board to the Supreme Court. Then there is sections 8 and 9, the data collection and maintenance of a public interactive tool showing information on health system performance, quality, access, and affordability. This will be at the board, and they will be working on that. It will be contingent on their finding funds to do it. That is in the bill. Section 10, this is the Public Employee Health Benefit Authority Study Committee. Now, I'm looking for a better name for that, and I have suggestions. The Public Employee Health Benefit Authority. So Oregon has a public health authority in place. Massachusetts has a primary care program. But this is an analysis by 11 public employee health benefits members to figure out how can we pool all these people who work in the public sector into a healthcare pool and build a public sector authority, oversight, a program. This could be exciting. So we put together, VLCT, educators, and VSEA maybe, see how it would go, and figure out how to have a less expensive insurance pool. There is a $50,000 amount in there that appropriations amendment will strike. Then there is an effective date on passage, and that's the bill. I think for us, of course, it's complicated. It's always more complicated than that. And I will, Mr. President, have an amendment in a little bit. Oh, I
No,
should say.
you're okay, I can
I
recognize
should say
you.
the vote was 5-0. I should also say that we have a long list of witnesses, and I'm happy to share those with you when I find it, but we're all set, I think. Thank you, Mr. President.
Thank you, Senator, and no rest for the weary. I recognize the senator from Chittenden District, Senator Lyons, for the report of the Committee on Appropriations.
Thank you, Mr. President. There is a 50,000 appropriation in the underlying bill. We have taken that out, and hopefully the treasurer will identify some money to use to complete the study on the public authority. Thank you, Mr. President. Vote in appropriations was 7-0.
The question is, shall the recommendation of amendment of the Committee on Health and Welfare be amended as proposed by the Committee on Appropriations? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and you have amended the recommendation of amendment of the Committee on Health and Welfare as recommended by the Committee on Appropriations. The senator from Chittenden, Senator Lyons, has an amendment to offer at this time.
Mr. President, I'd like to withdraw the proposed amendment in the calendar and offer a different amendment.
Yeah, you don't have to withdraw it. If you don't offer, it's considered not offered.
Thank you, Mr. President. Mr. President, I originally had put, and others have put in, a proposed amendment that would have changed the reference-based price based on the Medicaid standard, would changed it to allow for a 225% of what is currently done by hospitals. When we looked at that, as you can see on the bar graph I handed out, it would have really increased prices. So we went back to the drawing board, worked with our hospitals and others, and decided to stick with the 250%. There was also language in the amendment as offered that we would like to keep. So in the first proposal amendment, the language is similar to what's in the underlying bill, but it is better language. The reimbursement limit set forth in the section will stay in effect, so that's the 250% for the qualified health plans, until the board establishes an alternative. The second proposal was also in that first amendment that I'm not offering. So it's language improvement. It relates to allow for some flexibility in the budget process for our critical access hospitals for our hospitals when they're trying to get down to that 500% and what effect it might have on their financial status. I did add a new section. The third proposal amendment is new. It's a little bit complicated, but it's a working group that the Green Mountain Care Board will assemble to look at a very archaic Medicare provision that is separate, totally separate from anything else that's in the bill. And it's separate from the reference-based pricing, and it's separate from all the other stuff. But it is a provision that the federal government requires of hospitals, critical access hospitals, requires of critical access hospitals to pay federal government money. And so we looked at this in our committee. We said, this is an important thing for the working group to look at, because we'd like our hospitals to get out from under this horrible provision that forces smaller hospitals to pay money to the federal government. Nationally, it's $30 billion. In our state, it's 30 million. It's a lot of money. So, but it's not related to the underlying part of the bill. It was an issue that came up. The reason we put it in, have this working group in here, is that there were concerns expressed by the critical access hospital that if they had to compensate for the money that some patients were paying that goes to the federal government, the hospital had to compensate for that within this budget year, it would be difficult, administratively difficult, and it might also be financially concerning. So we put language in here that disallows the use of that, consideration of that solution in the budget. One solution for the federal law provision would be put it in the budget. And so we said, don't do it in the budget for 27. Have the working group come up with a solution, and that could be implemented outside of the legislative process, or it might be something we have to look at. So that's what's in this proposal. And I would ask for a support on this. This is an important amendment because it allows for us to go forward with a 250% of reference-based price for our qualified health plans, our QHPs, and it will help keep money in pockets for Vermonters. So thank you, Mr. President.
The question is, shall the recommendation of the Committee on Health and Welfare as amended be further amended as recommended by Senator Lyons, Senator from Washington?
Thank you, Mr. President. If you're as confused as I was by that last section, I'm not sure if it's punishment for being the student that raised your hand first, or if it's a cognitive test to see if I can remember what I learned 3 hours ago now. There is, for critical access hospitals, which isn't UVMC, it's all your small rural hospitals. There is a federal requirement. Normally, you go to the hospital, Medicare pays its rate. Then if you have supplemental insurance, it pays its rate. Sometimes that's everything else, sometimes it isn't. And then you pay what's left, or you pay a copay. But it starts with the Medicare paying and works up. In these critical access hospitals for outpatient services, Medicare requires, there is, I believe it's 20% copay or payment by the patient. Now the hospital sets a charge, and I'm not going to try and do math on the floor, but if that 20% of that high charge is equal to or greater than the charge, then Medicare doesn't pay anything. And so the cost is solely on, usually it's an elderly or it's a disabled person, usually it's in a rural community, and the advocates feel this is money that it's keeping Medicare from paying. It's putting the cost on to the individual patient first. It's been there forever, but it has become a burden for people. But again, if the senator from Chittenden, whichever, central, southeast, said, we're walking this fine line between trying to get costs down and not put our hospitals under. So this would set up a study group. If we just said, nope, you can't do that anymore, that could be enough to put them under. So the study group will look at a way to perhaps, we can't change federal law, but perhaps to be able to save what are really some of our most vulnerable patients the cost and get them the coverage they really should have.
Are you ready for the question? Senator from Orange.
Mr. President, I stand in support of this amendment, and people may ask, why do we have this provision of tying the hands of the Green Mountain Care Board for a year? And the reason for that is, if you look at what the senator from Chittenden has presented, we have put a lot on our hospitals in the last several years. They've cut their staff. They're trying to deal as best they can to deal with all these different changes. And so what we didn't want to do is put more burden on them in this year when they're trying to figure out their budgets with all these changes that we are putting on them. Give the study group an opportunity to look at this particular issue, come back with a recommendation, and then in the next budget year, as you heard from the presenter of the bill, this provision is only for 1 year. And then they would have a much better handle on exactly how to handle this and how to account for it in the next year's budget. Thank you.
Senator from Addison.
Thank you, Mr. President. First, just a comment. I appreciate the senator from Orange's comment. I hope that the members in the chamber will remember those comments when we're talking about education policy. It sounds very similar to the situation with our schools. One of the highest costs for affordability crisis right now in the state is actually health insurance rates for our constituents. And we are arguing to give hospitals more time to adjust to these. I hope that the same will hold true for giving our schools some time to adjust to some of the things we may or may not be doing to them. But with that being said, Mr. President, may I inquire of the reporter of the amendment?
The reporter's interrogated.
Thank you, Mr. President. I first have a question on section C. It's the second instance of amendment, paragraph C. The amendment specifically calls out such as primary care. And I'm wondering why it's worded as such as primary care instead of just saying for primary care service lines. Because is the intent to allow primary care to have more more cost or more higher reimbursement rates for primary care, or is it for all service lines?
Well, it's such as, so, you raise a good point. When we were talking about this in committee, we said, well, we don't want it to go to any service line. We don't, necessarily, we won't want it to go to maybe some equipment that is less important. We wanted to go to direct care services for patients. And we didn't want to spell it all out, and so we said such as primary care.
Okay, because the way I read it, this could go to any service line.
Yep.
Primary care is just an example. So if we want to make sure that we're directing any increased reimbursements to primary care, I think we need to be more directive of that, because the way I read it right now is that it could go to equipment service lines. But I think, given our focus on wanting to really increase support for primary care, I'm wondering if the committee considered just saying for one or more of its service, for primary care, or one or more, making the wording be more explicit that primary care is what we want to focus on.
But so that, that's part of the conversation that we had in committee, and it's a good point to be raised. There may be cases where it's a different service line other than primary care, and it might be something that is really fundamental to holding patients up, but not direct patient care. So we didn't want to be too explicit. So we leave it open for the hospitals and the decision-making going forward. So remember, each hospital is so different, each service need is different, and we couldn't predict. So that was the decision-making there.
Okay, I guess I would prefer to have it be more explicit that primary care is where we want to focus. But the second part, I'm still trying to wrap my head around this cost sharing situation, and I appreciated the senator from Washington's explanation. That did help. But is it that this working group would be trying to figure out how to prevent patients from having to pay the full cost of a service because Medicare will not reimburse more than 80%, or because the 20%? Yeah, I still am not clear about what this problem is that this working group is trying to fix, and why we would not let the Green Mountain Care Board address some of this in the budget.
So, good questions, both good questions. Remember, it's a Medicare provision, and it's I'll read you what it is.
Okay.
And so that'll help, I hope. Because it is confusing, there's no question about it. And it came up at the last minute. Well, not at the last minute. It came up because if hospitals are required to pay the money for the patient, and so I'll read it, then I'll explain it.
Okay.
Regarding the Medicare beneficiary cost sharing issue mentioned in the amendment, the issue is that Medicare requires beneficiaries, patients, to pay a co-insurance amount, so that's not out of pocket, of 20% of hospital charges. The hospital list prices. Patient has to pay 20% of that right up front for outpatient hospital services with no cap. So regardless of what the charge is, the patient has to pay 20%. Rather than the 20% of the Medicare payment rate. So anything above the Medicare rate, the hospital charges, the patient has to pay 20% on the whole thing. So it's rather than the 20% of the Medicare payment rate that Medicare requires beneficiaries to pay as co-insurance at prospective payment hospitals. So they're the larger hospitals, which is subject to a cap. So our larger hospitals have a cap.
Okay.
Well, patients don't have to pay that much at larger hospitals. To smaller hospitals, they can pay right up to the highest charge. This makes a Medicare patient's out-of-pocket exposure at critical access hospitals significantly higher than in other hospital settings, which can be a particular problem for Medicare beneficiaries without a supplemental insurance plan. So that's kind of the bottom line. What's happening is a critical access hospital charges for patients or Medicare patients, they have to pay this out of pocket up front first. And then there are other considerations. Now, if it's not paid for or the money doesn't come in, the hospital's stuck with that.
Yeah.
So then the question is about the charges and how is the charges regulated? That's a question for the board to look at. How
Okay,
do you
Mr.
regulate
President, may I stop the reporter just, I want to say back to you I want to say back to the reporter what the reporter said to make sure I'm understanding, because I think that explanation helps. So if I'm a patient and I'm on Medicare and I go to UVMMC, which is not a critical care a hospital, and I get some outpatient service from UVMMC, because it's just for outpatient services, correct? Okay, so I get an outpatient service there, and it costs, $1,200. But the cap for the non-critical access hospitals is actually $1,000. The Medicare can say, nope, you can't charge $1,200, you have to charge $1,000. So then my patient share there would be $200.
Right, so.
Correct? Because they cap it at $1,000, and then I have to pay 20% of that, so that's $200, correct?
Right, you pay 20% of the 1,000.
Correct, yes,
The
because it's
hospital
capped.
can charge whatever it wants.
Right, the hospital, but it's capped because it's not a critical care hospital. Okay.
Exactly.
So then if I go to a critical care hospital, like Gifford Hospital, and I get the same service, and it costs, there it's not capped, so it could be the same service, and maybe they're charging $2,000 for it because it's not capped. It's the same service, I'm the same patient, I have the same insurance, but it costs $2,000 at Gifford because there's no cap there. And instead of the 20% would then mean I would have to pay $400 for that same service because of the way that Medicare federal laws are applying to critical care hospitals versus non-critical care hospitals. Is that correct, Mr. President?
Exactly right.
Okay. Thank you. No, that's really helpful because I was trying to figure out what is the problem we're trying to solve. And I do remember hearing about this, but getting an amendment on the floor, trying to address it makes it hard to understand. So I am sympathetic to those. I think the reporter. I'm sympathetic to the critical care hospitals because they are all our smaller hospitals and having to adjust. And as it is right now, rural patients in many of our districts are paying more, in some cases twice or more than twice, just by the example that I just gave. You could be twice as much if you live in Chittenden County and go to UVMMC versus if you live in Rochester, in my district, and go to Gifford Hospital, and that is absolutely not fair. So I think there's an urgency at trying to solve this problem. I really wish we could do it without tying the hands of the Green Mountain Care Board, Mr. President. But I think given all the circumstances, we do need to give our smaller hospitals time to adjust. But again, I just want to remind everybody that this adjustment that we're allowing our small rural hospitals to make, we need to give the same grace to our small rural schools, because this is exactly the kind of issue that they are all facing. And I hear my colleagues standing up and asking for time for hospitals, and I appreciate that. And we also need to give time for our schools to adjust to changes that we're making for them as well. So I thank the presenter of the amendment, and thank you, Mr. President.
Senator from Chittenden.
Mr. President, you might notice that I did not sign on to the amendment. I just want to very briefly speak to that. I respectfully didn't sign on, I must say, because the work of this amendment is fantastic, and I know it was hard fought and all the players were involved, and so I really appreciate the work. But my reservation is in the third instance of amendment, section 3, 2B. As I said last year, the Green Mountain Care Board is a construct that came about in the legislature, and we have tasked them with regulating our hospitals and hospital budgets. So I was reluctant to not allow them to take part in next year's hospital budget, critical access hospital budget process. And particularly, we did hear that these Medicaid charges Medicare charges in the budget are part of the problem, and dealing with them could actually save the hospitals money. So I was reluctant there. We talk a lot about trust in our committee and the importance of trust with all of the players, and so I want to provide my trust with the Green Mountain Care Board. I'm also a little worried about the precedent that this might set, although I was told that we have told the Green Mountain Care Board what to do. We have directed them in the past. And I also just want to say that the chair of our committee did passionately state that this is a one-year provision and that it will not continue beyond 2027. Thank you, Mr. President.
Are you ready for the question? The question is, shall the recommendation of the Committee on Health and Welfare as amended be further amended as recommended by Senator Lyons? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it and the motion carries. Question now is, shall the bill be amended as recommended by the Committee on Health and Welfare as amended? Are you ready for the question? Senator from Addison.
Thank you, Mr. President. I was surprised that this bill did not actually go through the Finance Committee. I know that the chair of the Finance Committee is on the Health and Welfare Committee, but so much of this bill is dealing with health insurance, which I believe is the jurisdiction of the Finance Committee. Could I inquire of the reporter of the bill?
The reporter's interrogated.
Thank you, Mr. President. I'm just looking at sections 4 and 5 of the, in particular, of the bill, of the Health and Welfare report. And these are reports out, which I know are part of so many healthcare bills. But these two reports in particular are dealing with one tax, the hospital provider tax in one report, and the other is dealing with the health insurance for public employees and reference-based pricing, and also has an impact on, potentially on the education fund if VHI is involved. So I'm wondering if, I know this is a small thing, but I'm wondering if you would, if the committee would be amenable to just a tiny little change that would require that these reports also go to the Finance Committee and to the Ways and Means Committees, because these deal directly with their jurisdiction.
Mr. President, if the Finance Committee wishes to have that report, those reports, it's perfectly fine with Senate Health and Welfare.
I think that these reports should go to the money committees because they are dealing directly with the finance part. And I know that reports just go to the legislature and everybody can find them, but if they go specifically to the committee, then it's clear that that's the committee's jurisdiction. So maybe on third reading, we could just add that into the bill. Thank you, Mr.
Thank you, Mr. President. Certainly the comment in the reporting section by January 27 includes financial impacts influencing reference-based pricing. So that would be, our committee needs to look at that. And as we continue to look at hospital pricing.
Yeah, sure, Mr. President.
And then underlying that are the financial impacts overall. So that would certainly be something that Finance, Ways and Means, and others would be interested in.
Yeah, I'm not suggesting we would take health and welfare out of the report. It's just that these are definitely finance issues. So I thank the reporter. Thank you, Mr. President.
Senator from Essex.
Thank you, Mr. President. The part of the bill spoke about how expensive healthcare is in Vermont. In fact, 19.8% of Vermonters' paycheck goes to paying their premiums, while New Hampshire is at 4.8 and nationally is 7.9. So Vermont is absorbently expensive compared to our neighboring states and the national average. And in that time of rising costs, there's been two players. There's been the Green Mountain Care Board and the legislature. So, I just, I don't know what's going on as far as the cost in Vermont compared to the rest of the nation and even our neighboring states. And as far as the trust of the Green Mountain Care Board, last time they were in our neighborhood, they're trying to close our hospital. And that took a lot of time and efforts from all of our communities to make sure that everybody understood that it was just a recommendation, but yet it was still very harmful to our area. And we spent a lot of effort in there to calm the people down, to let them know that our hospital wasn't leaving. But in the meantime, we had a lot of people leaving our hospital and going down to the next hospital. So that wasn't helpful at all. The trust that I have in the Green Mountain Care Board in making decisions isn't very well. In fact, I think I'd rather stand between a pack of wolves and a wounded buffalo and take my chances. I would like to inquire of the reporter of the bill, please.
The reporter is interrogated.
How can we be sure that S-190 is going to do, as the reporter has indicated, and reduce costs for Vermonters, and put, as it was said, more money back in the pockets of Vermonters?
That's a direct direction to the Green Mountain Care Board in Section 2, requiring the board to ensure during the rate review that the hospital reimbursement caps are appropriately reflected in premiums for qualified health plans. And that's for 27. So it's those qualified health plans that cover about 88,000 Vermonters. And that money that we're saving through the reference-based pricing based on Medicare, 250%, will be directly correlated with reduced rates for premiums for Vermonters. It's in the bill. And that is something that we will follow up with next year.
Mr. President, where has this done before? Is there a record? Is there a track record of where a plan like this has worked?
Not sure what the question is. The answer is that yes, reference-based pricing and having a cap on expenditures has worked. And just as, for example, if you look at the handout that I gave you with the budget orders, in Act 68, there was a direction to lower the budget by 2.5%. That's happened. The budget orders to hold budget stationary, that's happened. And that's resulted in $230 million reduction. What hasn't been in legislation previously is the return of some or all of those monies into premium reduction. So we'll see how this works.
So, Mr. President, if I understand this correctly, this has happened in other states or other areas, other hospital groups, to where one could point to that and say that this plan does work?
The only way I can answer that is I don't know about the regulatory system in other states. I know a few states, but not many. I do know that the reimbursement rate of 250% of Medicare base rate is used in other states, and it has resulted in what you have identified, Mr. President, as lower costs in other states. So Maine, New Hampshire, other states, all the other states.
I thank the reporter, and thank you, Mr. President.
Are you ready for the question? Senator from Rutland.
Thank you, Mr. President. May I interrogate the presenter of the bill?
Reporter's interrogated.
Thank you, Mr. President. Just curious if JFO was brought in for an independent analysis of this bill to validate that it has any of the desired effects while avoiding unintended consequences.
No, Mr. President, we did not. This is not something that JFO does on a regular basis. We did hear from Green Mountain Care Board and others who are directly involved in the cost reductions. Hospitals, our education folks, Green Mountain Care Board, insurers. So that's how we get our data.
Thank you, Mr. President. I thank the reporter of the bill. While I do respect the professionalism of the Health and Welfare, Senate Health and Welfare Committee, and of course our professional healthcare providers, but given the fact that Vermont is currently experiencing the highest healthcare costs in the nation, and without any type of JFO analysis to reference, I have zero confidence that we have figured out the cause and remedies for our state's healthcare costs. And for that, I give no vote on this bill. Thank you, Mr. President.
Are you ready for the question? The question is, shall the bill be amended as recommended by the Committee on Health and Welfare as amended? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it. And you have amended the bill as recommended by the Committee on Health and Welfare as amended. Now the question is, shall the bill be read a third time? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay.
No.
The ayes appear to have it. The ayes do have it. And you've ordered third reading of S-190. I understand we will go back to the cannabis bill to finish third reading as the amendment is now ready. Senator from Chittenden.
Thank you. To answer the question that was asked, generally speaking, state law does not supersede federal law or HUD policy. In fact, there's already many instances in 9 VSA Chapter 147, which governs landlord-tenant law in Vermont, where these inconsistencies exist with federal law or HUD policy. In these instances, federal law supersedes. So it is likely that this will not impact leases for federal.
Senator, excuse me, if I could interrupt you before you offer this one, you need to withdraw the first one.
I will, but I wanted to answer the question before.
Okay, sorry to interrupt then. Thank you.
Yes. Anyways, where was I? Okay, so generally, federal law, like I said, it would already supersede, and it is likely that this policy that we're putting forward would in fact be superseded by federal law. However, due to the fact that my understanding was we wanted a definitive answer today, and the HUD policies are 1,163 pages long, which made it difficult to do the thorough legal analysis that would definitively say this does not apply. And so to that end, I will be withdrawing this amendment and offering a substitute to this amendment that explicitly says that this policy does not apply to leases governed by federal law or HUD policy. Again, it is likely that this is not necessary, but due to wanting to move it forward definitively, we will be withdrawing the amendment that was not in the calendar and replacing it with another amendment that is not in the calendar and will be passed out now.
We will consider the amendment withdrawn without objection. And we will now be passing out the new amendment. Senator from Chittenden.
Thank you, Mr. President. Perhaps while that's being passed out, I will just quickly say that our Economic Development Committee had an opportunity to look at the change and understand the change. And by a straw poll is supportive of this change unanimously. The only thing I'd add, Mr. President, is that not only do we have a lot of housing policy governed by federal law, and we do often put these kinds of statements in, but there is potential when cannabis becomes descheduled or differently scheduled, that certain housing policies don't follow that right away. There is a congressional bill on the consumption of cannabis in Section 8 housing or someone's federally subsidized housing that is not likely to make it anywhere anytime soon. But we certainly see both the inquiry of the senator from Caledonia and the accepted change from the senator from Chittenden Central as a friendly one.
Are you ready for the question? Senator from Caledonia.
Thank you, Mr. President. I do appreciate the language change. I think it alleviates what my potential concern might have been, and I'll be voting for the amendment.
Are you ready for the question? The question is, shall the bill be amended as offered by the senator from Chittenden Central? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. Ayes have it, and we have amended the bill as offered by the senator from Chittenden. Are there any amendments prior to third reading? Listen to the third reading of the bill.
S. 278, an act relating to cannabis.
Question is, shall the bill pass? Are you ready for the question? If so, all in favor, say aye.
Aye.
All opposed, nay.
Nay.
The ayes appear to have it. The ayes do have it, and you have passed S 278. Senator from Chittenden.
Thank you, Mr. President. I applaud the good work this morning. It's gone a little slower and more methodically than I had thought. But before we end today, I would like to do one piece of business that is time sensitive, and that involves the Taiwan resolution that you will see on the notice calendar. We will have a delegation from Taiwan here on Tuesday. So with that said, Mr. President, as our last order of business today, I would like to bring up the Taiwan resolution by a suspension of the rules. So with that, I will move that our rules be suspended in order to allow us to take up for immediate action SR 24.
Could we take a brief recess while I confer with the President Pro Tem?
So we'll meet over in the corner, okay? So-
Will the Senate please come to order? Senator from Chittenden.
Thank you, Mr. President. I would like to alter my motion. This resolution will need a bit more work, so I would like to ask that the rules be suspended in order to allow for a motion to recommit to the Committee of Jurisdiction. So, Allison.
So Senator, I believe what you've asked for is a motion to suspend the rules so that the resolution can be returned to the Committee of Jurisdiction.
Something like that. What does that mean?
We don't know if it's necessary, but this is the way we're going to try it. And the Senator from Chittenden has moved that the rules be suspended to allow for a different motion. All in favor, say aye. Aye. All opposed, nay. The ayes have it, and we have suspended the rules. It just helped. Yeah, so to explain the confusion, because we're in the orders of the day, we needed a motion to allow recommittal of a bill, which we just passed, and now we will have the senator from Windsor make a motion.
Thank you, Mr. President. I would like to move that the resolution on Taiwan be recommitted to the Senate Economic Development, Housing, and General Affairs Committee.
The senator from Windsor has moved that the resolution on Taiwan be recommitted to the Committee on Economic Development. Are you ready for the question? If so, all in favor, say aye.
Aye.
All opposed, nay. The ayes have it, and the motion carries. Senator from Chittenden.
Thank you, Mr. President. Pending announcements, I would move that the Senate stand in adjournment until 9:30 a.m., Tuesday, March 31st, 2026.
Are there any announcements? Senator from Addison.
Thank you, Mr. President. Yesterday on the floor, we did an amendment about a housing report for farm workers. And last night, I found out that this is Farm Worker Awareness Week. And actually, the governor did an executive proclamation noting that the week is Farm Worker Awareness Week. And I will not read the whole thing, but I just wanted to note it, and that there are 2.6 million farm workers in the United States. They provide all Americans with access to safe, healthy, and affordable food, and they're essential to their contributions to the foods we purchase and often go unseen. They continue to work and meet and exceed the challenges of Mother Nature and perform under extreme pressure during the pandemic and other global challenges. So I just wanted to, there's more to the resolution, but wanted to give out a shout out to all the farm workers, and I appreciate that the governor did this official proclamation and thought it was timely given what we did yesterday. So thank you, Mr. President.
Are there any further announcements? Senator from Washington.
Thank you, Mr. President. Senate Finance will meet at 2:10. Get your lunch and come to committee.
Senator from Windsor.
Thank you, Mr. President. First, I'd like to celebrate an equal pay body and chamber. The General Assembly is one of the few places where all of us are paid equally. No matter, well, I'll leave it at that. And the second announcement is Senate Economic Development, let's please meet immediately after the fall of the gavel in this corner.
Senator from Washington.
Thank you, Mr. President. Senate Appropriation will meet at 2 o'clock.
Senator from Rutland.
Government operations will meet immediately at the fall of the gavel.
Senator from Wyndham.
Senate institutions will meet at 2.
Senator from Bennington.
Mr. President, the Senate Education Committee will meet at 2:15.
Are there any further announcements? Seeing none, the senator from Chittenden Central has moved that the Senate stand in adjournment until 9:30 a.m. Tuesday, March 31st, 2026. Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it, and we'll stand in adjournment till 9:30 a.m. Tuesday, March 31st, 2026.